Hi, good afternoon, guys. Ismaila here from IGH Global Health. So what I wanted to talk about today is what is a generic medication? As a company that runs a U.S. pharmacy in the Gambia, we have noticed that a lot of times people may not understand actually what a generic medication is by how a drug is delivered or discovered. So with any medication, once a company, let's say IGH Global Health, creates a medications for hypertension, they have to go through clinical trials, especially from a US standpoint. Every medication, a new drug application has to go through trials to prove that it's safe and it's effective. So if it's a brand new medication that has never existed on the market, they have to do preclinical trials where they do animal testing, and then they transition over to human studies, which gives us a clinical trial. The clinical trial for human studies is where the company has to prove that the drug is safe and is effective. So if it's a blood pressure medication, somebody should be able to safely take it and see that their blood pressure goes down. It's a medication. So as you notice, most of the times you'll see a brand name, let's say Lipitor. Lipitor was one of the top selling medications when it came out for cholesterol. But the actual drug itself is not Lipitor. The drug is atorvastatin, which is the chemical name. So most of the times, a lot of people get more attached to the brand name, which is more commercial, than the actual chemical name. So for example, Lipitor, the chemical name is atorvastatin. Now, once the patent runs out, any company, let's say IGH Global Health Manufacturing in the Gambia, decides to come out with atorvastatin, which is the same as Lipitor, we then, from a US standpoint, have to file what's called an abbreviated new drug application, an ANDA. The only difference between an abbreviated and a regular new drug application is the abbreviated, you don't have to do the clinical studies in terms of testing it in animals and human studies. The test that you have to do at that point is called the bioequivalence, meaning if you are a company now that is making a generic. So the term generic basically means you are not the person who discovered that particular drug, but you have the capability to produce that chemical name, meaning only one person could discover Lipitor, but atorvastatin as a chemical name, any drug manufacturing company can make atorvastatin, which I have atorvastatin in front of me right now as an example, which is a US brand, but you don't see Lipitor on the name. So if you're interacting with a pharmacy, just be aware that most of the times we do most of our knowledge, our training on the chemical names. So you could go to Europe and they may not call it Lipitor, they could call it something else, but the chemical name is atorvastatin. So it's really, really key to remember as well too. So most of the times when you're interacting with a pharmacy, especially with us introducing a lot of FDA medications onto the Gambian market, be aware that sometimes there could be some changes because not every drug is on the US market, but most of the times if it's a class of drug, let's say for hypertension or cholesterol or diabetes, there has been a generic that is approved for the US market, which would be designed to do exactly the same thing. So one of the key examples that I wanted to use, which is a very famous brand name, which is Tylenol, the medication itself is not Tylenol. Tylenol is, from a marketing standpoint, the drug name is acetaminophen, which is a very common pain relief that people use for fever. Same thing with Advil. So most of the times if you come into a pharmacy and you say, I want Tylenol, you may get acetaminophen. If you come to the pharmacy and let's say you're an asthma patient and you want Ventolin or ProAir, right? You may get albuterol, because remember, brand name and the generic. The generic deals more with the chemical name. So technically, if you don't receive ProAir, you may receive albuterol sulfate, which is an inhaler, which is exactly the same. So key things to remember. So generic, the term generic, most of the times people think it's something bad. Not necessarily, right? And one of the biggest misconceptions as well too is like, well, if a generic is made, let's say in India, then that means it's bad. Well, actually, India produces most of the generics, even for the US market. But going back to how the FDA, which is the Food and Drug Administration of the US, approves medications, even if you are manufacturing in the Gambia, you have to prove that there's a bioequivalency, meaning if you produce, for example, atorvastatin for cholesterol, that if you test it with a product that's already available, you would see that your body absorbs it on the same level. It does the job exactly the same before you approve it into a US market. So just one thing to keep you guys in mind as well, to always remember there's a key difference between the brand name and a generic, but the chemical name is the most important thing in understanding what a medication is supposed to do. At least that's how the FDA structure works in terms of approving medications that are not brand name as well too. So thank you. If you guys have any questions, always remember, IGH Community Pharmacy, we have a pharmacist always on staff, but one of the things we wanted to do is we introduce FDA medications from the US into the Gambia market is educate people on the process.